So, very good evening, everyone. It again gives me immense pleasure to welcome you all for, I would say, a very, very important and interesting episode, which is gonna be technology. We all love technology. I would say, are addicted to technology, and technology is ever progressing. If we will see in the last 50 decades and the 50 years, the technology has progressed in every field. So if we have to name a few, I think it would be endless. So just in medicine, you will see the technology has helped us in many ways, treating our patient, diagnosing our patient, and the most important factor, I would say, is how to manage the sugars of our patient. So let's hear it from our technology team experts. We have the technology task force members today, four of them from the RSSDI team. Let me welcome each. So let me start with Dr. Jothydev K, Senior Consultant Physician and Diabetologist. He's the chairman of Jothydev Research Center, Trivandrum, editor-in-chief of International Journal of Diabetes and Technology, and I would say a master when it comes to the CGMS, that is the continuous glucose monitoring system. So very good evening, sir.
Good evening, Dr. Faris and the team. Thank you very much.
Let me welcome our one more senior colleague, Dr. Sunil M. Jain. He's a senior consultant endocrinologist from Indore and also has a lot of publications on technology and has been doing a lot of work into it. Very good evening, sir.
Good evening. Yeah, good evening, everybody. Good evening.
Let me take this opportunity again to welcome my very good friend, Dr. Mithun Bhartia. He's again a senior consultant endocrinologist and sex medical specialist from Guwahati. Very good evening, Dr. Mithun.
Good evening, Faraz. Thank you. Thank you for your kind welcome to us.
And last but not the least, I would say it would be incomplete. Have our one more expert, Dr. Manoj Chawla, senior consultant physician and diabetologist, again a member of the task force team. He's the director of Lena Diabetes Center from Mumbai. Very good evening, Dr. Manoj.
Thanks, Falash, and evening to everyone in this panel and all those who have joined from all over.
Yeah. So thank you all. And without taking much of time, I would hand it over to Dr. Manoj to take it from here.
Thank you, Faraz, and a very warm evening to all of you. And let me start by thanking RSSDI functionaries and the social media team for asking the technology task force to meet again on this platform to discuss an important aspect of the evolution and what's changed in glucose monitoring over the last 50 years as we celebrate the 50 years of this wonderful association, the RSSDI. A lot of us who treat diabetes go by the dictum or by the statement that Professor Elliot Jocelyn, who's considered as the father of diabetes, said, a diabetic who knows the most lives the longest. Now, the modern version of this statement has been that a diabetic who monitors the most probably lives the longest and without complications. So diabetes is like a roller coaster. It has its ups and downs, but as a person with diabetes, it is your choice to scream or to enjoy the ride. And all four of us here are here to throw some more light on how glucose monitoring, different aspects, the evolution, the different metrics that we speak about, it has evolved to where we are today. We have a wonderful discussion for you. So we know this is for patients, and many of us here will try and speak both in Hindi and English to keep the explanation clear. What Dr. Jothydev says, also he will simplify with words in between in Hindi for our larger national audience. Right. So आप सभी के लिए बहुत बहुत स्वागत है यहाँ पे. आपके प्रश्न आप पूछिएगा. शुगर मॉनिटरिंग में हमने क्या सुधार की है, किस किस्म से शुगर की मॉनिटरिंग की जानी चाहिए, उसी के लिए एक्सपर्ट्स हम आज यहाँ पे जमा हुए हैं. आपको इसके बारे में बेटर आइडिया देने के लिए. So today, managing diabetes by any physician, any endocrinologist, any diabetologist is unimaginable without seeing the numbers. As we celebrate 100 years of insulin discovery, which is probably one of the biggest discoveries in the field of diabetes and medicine, we also celebrate how glucose monitoring has evolved and how we are able to see the larger picture and help our patients with diabetes. So, to set the motion ahead, let me pass on this next question to Dr. Sunil Jain from Indore, who will then take the discussion ahead, and we will rotate this amongst all of us and enjoy this session with you all. So, Dr. Jain, you are the senior most probably amongst us here, and we all remember that earlier days it was just urine sugar testing. So, आपसे ये जानना चाहेंगे कि is it still important? What were the days? How were we managing with only urine sugar? And what today is the relevance for urine sugar? Our patients who have joined us, our general population who wants to know the importance of urine sugar. Over to you, Dr. Sunil Jain.
Yeah, so Dr. Manoj, that's a good question. Urine glucose, blood glucose, many times our patient ask us कि सर यूरिन की डायबिटीज है कि ब्लड का डायबिटीज है. सो ऑब्वियसली देखिए शुगर तो ब्लड में ही बढ़ती है, तो हम लोग डायबिटीज का मतलब होता है कि ब्लड में ग्लूकोज ज़्यादा है, उसको हम डायबिटीज कहते हैं. अब यदि हम पीछे जाएं, जब हम लोग स्टूडेंट्स थे उस जमाने में हमारे पास एक ही जरिया था ये समझने का कि ग्लूकोज कितना है. वो ये है कि यूरिन को लेते थे पेशेंट्स और उसमें एक बेनेडिक्ट रिएजेंट मिलाते थे, 2-3 मिनट गर्म करते थे, उसके कलर को चेक करते थे और ये जजमेंट बनाते थे कि शुगर कितनी है. फिर यूरिन की स्ट्रिप्स आई और आज भी कई लोग यूरिन ग्लूकोज मॉनिटरिंग करते हैं. लेकिन यदि हम सही अर्थों में समझें तो आइडियली हमें अगर टेस्ट करना है तो हमारे ब्लड में कितना ग्लूकोज घूम रहा है ये चेक करने की ज़रूरत है. अब आज के एरा में इन द प्रेजेंट टाइम we have now switched to glucometers which are so easy. They require a very tiny drop of blood, then CGM technology. So obviously urine glucose monitoring for management of diabetes in general is not needed, but there are few important things which I would like to bring here. तो मैं ये कह रहा था कि आज के ज़माने में यूरिन में ग्लूकोज नापने का डायबिटीज़ के इलाज के लिए अब कोई महत्व नहीं है, क्योंकि हमें ब्लड में ग्लूकोज नापनी चाहिए. एक ऐसी कंडीशन होती है जो बहुत कॉमन नहीं है, जिसमें ब्लड में तो ग्लूकोज नॉर्मल रहता है लेकिन यूरिन में ग्लूकोज ज़्यादा होता है. उसे डायबिटीज़ नहीं कहते, उसे रीनल ग्लाइकोसूरिया कहते हैं. तो कभी कभी हम कुछ मरीजों में ये देखते हैं. और दूसरा, आजकल आपने सुना होगा, आपके डॉक्टर ने भी बताया होगा कि एक टेबलेट ऐसी आती है जो कि डायबिटीज़ में भी लाभकारी है, किडनी और हार्ट में भी यूज़फुल है, और ये टेबलेट यूरिन से ग्लूकोज बाहर निकालकर आपको ठीक करती है. अब ऐसे में यदि आप देख रहे हैं कि आपकी यूरिन में ग्लूकोज 4+ आ रही है लेकिन आपका ब्लड में ग्लूकोज नॉर्मल है, तो आपको चिंता करने की कोई ज़रूरत नहीं है. इसका अर्थ ये कि ये टेबलेट अच्छे से काम कर रही है. तो ये था आज के समय में यूरिन ग्लूकोज मॉनिटरिंग का स्थिति. तो डायबिटीज़ के लिए यदि आप यूरिन ग्लूकोज चेक कर रहे हैं तो मेरी सलाह है कि सब बंद कर दीजिए और इसकी जगह अब हम आगे बढ़ेंगे, क्योंकि समय के साथ बहुत बदलाव आए हैं. करीब 40 साल पहले ग्लूकोमीटर टेक्नोलॉजी शुरुआती दौर में ईजाद हुई, तब ये बड़ी कॉम्प्लिकेटेड थी. 40-50 साल हुए होंगे और उसके बाद धीरे 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 इसका बहुत सरलीकरण हुआ. तो हमारे बीच एक्सपर्ट है. वी हैव डॉक्टर ज्योतिदेव विद अस, who is a technology expert, who will give us a brief that how the glucometer technology evolved in last 50 years, how it is made so simple, and that's how we can monitor our diabetes in a very easy way with these technologies. So over to you, Dr. Jyoti.
You are on mute, Jyoti.
Thank you very much. First of all, hello to my dear friends, Dr. Manoj, Dr. Mithun, Dr. Sunil Jain. and thanks to the RSSDI team for this opportunity. So we have, so I am to answer the question on how the glucose monitoring evolved over the last 50 years. And last 50 years is the history of our RSSDI as well. So we started with the Benedict's reagent, boiling the urine, and that was what Sunil Jain described in detail. And I am also having a personal experience in many patients. And then in 1965 onwards, of course, we were not born at those times, we started using a strip for measuring the glucose in the blood. But those times, glucose meters were not available. And the patients themselves started using glucose meters by around 1970. And that was the beginning of AIMS reflectance glucose meters. But some of you very senior people, you might remember that it took almost 5 to 7 minutes to measure glucose with those old glucose meters. And they improved over the time. And I'm still having one of those third or fourth generation of the AIMS reflectance glucose meter with me. But eventually what happened, as Dr. Sunil Jain said, we are now having glucose meters, and these are the plasma calibrated. For the last 15 years, we are having plasma calibrated, means when you are pricking the fingertip and measuring the glucose, we are getting almost a similar value as the blood which is measured in the laboratory. But if I am to update you on the 2022 American Diabetes Association recommendations, in the market, you might have many glucose meters, but they are not having a similar accuracy. So discuss with your doctor, discuss with your diabetes educator on which is the best glucose meter which is reliable and accurate for you. Because as Dr. Manoj said at the beginning, it is very, very important that you should be monitoring the glucose. Whatever be the stage of diabetes, whatever be the duration of diabetes, whatever be the type of diabetes, even in the stages of pre-diabetes, that is before the occurrence of actual diabetes, you should be monitoring. You should be monitoring glucose yourself, and that is self-monitoring of blood glucose. It was in 1999, Minimed Medtronic introduced the continuous glucose monitoring devices, and that was a CGMS board which we started using in India in the year 2004 onwards. Of course, it was a research tool to begin with, but now it has become a standard of care. It is one of the established glucose monitoring technologies. So let me now ask my dear friend, Dr. Mithun, Bhartia a question. And this is on, I know that you have a passion for discussing with hemoglobin A1C, its limitations, its advantages, the demerits. And my question is for those listening to us, do we have to have a specific time for measuring hemoglobin A1C? What are the limitations? And do you think that this is going to stay forever? And how often? Do we have to repeat it every month or every 3 months? So how often do we have to repeat hemoglobin A1C? Over to my dear friend and expert, Dr. Mithun Bhartia.
Thank you, Dr. Jothydev. Now, मैं ये जो आप अपने डॉक्टर के पास जाते हैं, वो हमेशा बोलते हैं कि HbA1c टेस्ट कर लो, और HbA1c इतना टेस्ट पॉपुलर हो गया है कि लोग अपने आप ही HbA1c जाते हैं, लैब का एक पैकेज कराते हैं, HbA1c करा लेते हैं. तो कुछ भी कराने के पहले मैं एक सरल हिंदी में समझाता हूँ ये HbA1c है क्या. तो हीमोग्लोबिन को अगर आप एक बॉल समझ लो, उसमें फेविकॉल लगा के आप अपनी बॉडी में फेंक दो, और 3 महीने के बाद वो बॉल निकालो तो कितना शुगर चिपका, वो आपका HbA1c है. That will tell us कि आपके शुगर की मात्रा आपकी बॉडी में कितनी है. अब इसमें बड़ा लॉजिकल है, अगर आपके बॉल्स ही कम होंगे तो आपका HbA1c का रिपोर्ट ऊपर नीचे होगा. तो अगर हीमोग्लोबिन ही ऊपर नीचे है तो आपकी रिपोर्ट्स HbA1c इतनी रिलायबल नहीं हो सकती. सेकंड, नॉर्थ ईस्ट या कुछ प्रांतों में एक हीमोग्लोबिन ई डिजीज है, डिजीज नहीं कहेंगे, उनका हीमोग्लोबिन कुछ अलग है, कोई बीमारी नहीं है बड़ी, उसके कारण भी आपका ये HbA1c टेस्ट बड़ा रिलायबल नहीं हो सकता. HbA1c आपको आपके पिछले 3 महीने तक का एक रफ एवरेज बताएगा कि कितना आपका HbA1c है. हम टारगेट चाहेंगे कि 6.5 के आसपास आपकी परसेंटेज चले, लेकिन एक चीज की हमेशा ध्यान रखिए, जिंदगी में कुछ भी 100% नहीं होता, थोड़ा ऊपर थोड़ा नीचे अलाउड है. तो 0.3% ऑफ HbA1c ऊपर नीचे कोई भी लैब का हो सकता है. इस बात को आप हमेशा ध्यान में रखें, क्योंकि इतना एरर अलाउड है बिकॉज ऑफ इट. और उस चीज को समझ के आप करें। और एक चीज और लिमिटेशन है कि हमारे यहाँ एक डॉक्टर शॉपिंग भी होती है। अब पेशेंट बॉम्बे जाके मनोज चावला सर के पास जाके आए हैं, फिर वो गुवाहाटी आते हैं हमको बताने, हम तो बॉम्बे के डॉक्टर को दिखा के आए हैं, मुझे नहीं बताते कि मुझे खराब लगेगा, उन्होंने दवाई चेंज कर दी, तो वो रिपोर्ट इतना रिलायबल नहीं होगा। तो आपको पिछले 3 महीने का रिफ्लेक्शन ये है, अगर आपने कोई दवाई चेंज नहीं किया तो ये हर 3 महीने में करने से आपको आपका एक परसेंटेज का ट्रैक मिलेगा, और ये कोई भी समय आप कर सकते हैं, इसके लिए खाली पेट की आवश्यकता नहीं है। अब इसके बाद अगर हम लोग बात करें तो अब दुनिया आगे बढ़ रही है, अभी यूरिन शुगर में आया, एसएमबीजी में क्या है, HbA1c में क्या है, आजकल नई दुनिया है, नई सोच है, तो हम कहते हैं CGMS कर लो, कंटिन्यूअस ग्लूकोज मॉनिटरिंग कर लो। तो इसके बारे में मैं चाहूंगा कि डॉक्टर चावला हमें थोड़ा बताएं कि ये क्या है, इसको कैसे करें और इसके क्या फायदे हैं। ओवर टू यू मनोज।
Thank you, Mithun. I think that was wonderful explanation. So, जैसे डॉक्टर मिथुन ने बताया कि शुगर मॉनिटरिंग हैज इवॉल्व्ड. In fact, it evolved from urine glucose monitoring to SMBG या use of glucose meters. Dr. Jothydev told us. In fact, I remember there was a time during our residency कि machines and strips बहुत expensive होती थी. एक आध मशीन होती थी पूरे हॉस्पिटल मेडिसिन वार्ड में, एंडोक्राइन वार्ड में, एंड हम जो स्ट्रिप्स पेशेंट्स लाते थे उसी को हम 3-3 में काट के, बिकॉज तब हम मशीन में नहीं डालते थे, बिकॉज मशीन को पूरे स्ट्रिप की जरूरत पड़ती थी, तो हम वो ब्लड का ड्रॉप लेके वो फिजिकली डाल के हम कलर कंपेयर करते थे, बिकॉज वी कुड देन कट अ स्ट्रिप इनटू 3 पोर्शंस and use it for 3 readings rather than the full strip, which was more expensive. So all of us here have as we say in India, we do something, some jugaad, some setting to try and work towards the favor of the patient. Now, as things have evolved, we also do realize that as things move ahead, that what we felt was good enough may not be good enough, and there are limitations of every metric, every technology that we use. SMBG, great aspect, tells us the sugar at that point in time, doesn't tell us anything what's happening before or after. HbA1c, a wonderful tool to tell us about overall control, but it is an average. It takes into account all the ups and downs and gives us an average. So there may be different individuals जिनकी sugars ऊपर नीचे जा रही है, किसी की बहुत ऊपर और बहुत नीचे, and somebody may have closer to the normal range, and both of them may have the same HbA1c. And this is where comes in CGM, which stands for continuous glucose. Right. So CGM, right, is a means of checking the sugar on a near continuous basis. CGM जो devices हैं, they measure what is called as interstitial fluid glucose, which is a little different from the plasma glucose, but quite parallel to it. Now, CGM devices may be used for 7 days, 14 days, and in the West now we already have implantable CGM devices which are valid up to 6 months. Hopefully, we'll get them in India as well. ये CGM devices essentially दो किस्म की होती हैं. One, which is blinded or professional or retrospective. This kind of device is usually attached at the doctor's clinic. The patient doesn't get to see the data normally. They come back after a 1 or 2 week period. The data is downloaded, and this helps in seeing the pattern or trend. So जहां पे there may be a disparity between the SMBG reading या HbA1c, or patient really wants to see how the sugars are behaving, doing a professional retrospective CGM on an intermittent basis, once in 6 months, once in a year, depends on patient's affordability. This CGM is a wonderful tool to see the larger picture. And this has also given evolution to a new term, time in range, which we will speak about soon. The other CGM is the real-time personal use CGM, जहाँ पे patients are taught to use it themselves. So patients attach the sensor to themselves, they use the device, and they see the sugar on a real-time continuous basis, which helps them to avoid hypoglycemia, because उस time पे sugars वो खाली एक time की reading नहीं, they are able to see the actual direction and whether the sugar is going down or high, and they are able to take action either through their meal, intake of sugar, insulin dosage, medication dosage, and so on. So two basic differences: one which is the blinded professional, and second which is the real time CGM, which is meant for patients, used more by patients who are on multiple daily insulin injections or those who use insulin pumps. It's a wonderful tool for them. Though anybody with diabetes today can use either of the CGM technologies to understand better about their sugar profile. One of the other aspects where this becomes extremely important is during pregnancy, which gets us to the next question, which I will put to Dr. Sunil Jain. That, Dr. Jain, very often we have now patients who themselves hear about this technology and come and ask us that my gynecologist wants me to have better sugars during pregnancy. Somebody suggested CGM. What is the role of CGM in pregnancy and how can they use that? Over to Dr. Jain.
Yeah, so thank you, Manoj, for this question. You have already explained in detail what is CGMS, that is continuous glucose monitoring. So till the time we have already discussed the testing by glucometer, the average test was 3 months. But now we are in the world of continuous. Every minute we can see the glucose number. That is what is CGMS. Now when it comes to pregnancy, what is our need? We want normal glucose during pregnancy. वी डोंट वांट नियर नॉर्मल रेंज, राइट. सो इसका मतलब ये है कि जैसे हम बोलते हैं ना कि फास्टिंग इतना होना चाहिए, एक डायबिटीज का पीपी यहाँ तक चलेगा, प्रेगनेंसी में ऐसा नहीं है. प्रेगनेंसी में तो हमें लगभग नॉर्मल रीडिंग चाहिए सभी. मतलब यदि हम ग्लूकोमीटर की रीडिंग से बात करते हैं तो हमारी कोशिश ये होती है कि प्रेगनेंसी की अधिकतर रीडिंग 95 के नीचे और खाने के 2 घंटे बाद की रीडिंग 120 के नीचे होनी चाहिए. लेकिन यदि हम ग्लूकोमीटर से चेक कर रहे हैं तो हम कितनी बार चेक कर सकते हैं. वहीं यदि हम कंटिन्यूस ग्लूकोज मॉनिटरिंग यूज कर रहे हैं तो हम मिनट टू मिनट पेशेंट का ग्लूकोज देख सकते हैं. और यदि हम ऐसा कर पाते हैं तो हम इस प्रेग्नेंट महिला का ग्लूकोज लगभग नॉर्मल उस सीजीएमएस डेटा के बेसिस पर अपने इलाज को बदलकर उसे लगभग नॉर्मल रख सकते हैं. और यदि ड्यूरिंग प्रेगनेंसी ग्लूकोज लगभग नॉर्मल रहे तो मैटरनल चाइल्ड हेल्थ, बच्चा और माता दोनों का स्वास्थ्य आज भी और भविष्य में भी बहुत अच्छा रहने की संभावना रहती है. और जैसा कि TIR, दैट इज टाइम इन रेंज शब्द डॉक्टर मनोज ने यूज किया, हम एक ग्लूकोमीटर में एक पॉइंट की रीडिंग देखते हैं. अब CGMS में हमारे पास में बहुत सारे डेटा होते हैं, तो आजकल एक और शब्द यूज किया जाता है कि 24 घंटे में कितने घंटे तक हमारी ग्लूकोज नॉर्मल रेंज में रही. तो प्रेगनेंसी में हमारी ज़रूरत यह है कि एक पेशेंट की ग्लूकोज करीब एटलीस्ट 70% टाइम 54 से 140 के बीच आनी चाहिए यदि हम CGMS कर रहे हैं. और बचे हुए समय भी उनकी ग्लूकोज बहुत ज़्यादा कम नहीं होनी चाहिए, न ज़्यादा होनी चाहिए. तो अगर हम प्रेगनेंसी के दौरान CGMS करके ये देख लेते हैं कि क्या प्रेगनेंसी के महिला का ग्लूकोज उस रेंज में चल रहा है, तो इस बात की बहुत अच्छी संभावना है कि फ्यूचर में डिलीवरी के टाइम बच्चे का वेट, बच्चे में होने वाले कॉम्प्लिकेशंस, उन सब से हम बचा सकेंगे. तो मुझे लगता है कि अब हम धीरे धीरे जैसे जैसे टेक्नोलॉजी स्विच हो रही है, कोई आश्चर्य नहीं होगा कि भविष्य में पूरी प्रेगनेंसी के दौरान हम इन महिलाओं का कंटिन्यूस ग्लूकोज मॉनिटरिंग के जरिए हर वक्त ग्लूकोज को नॉर्मल करके रख दें. तो यदि हम ऐसा कर पाएंगे तो निश्चित रूप से प्रेगनेंसी और डायबिटीज़ के इलाज में ये बहुत बड़ी मदद होगी. और अब देन देखिए, एक चीज़ और हम देखते रहते हैं कि कई बार एक बार पेशेंट हमारे पास में OPD में एक रैंडम ग्लूकोज लेके आ जाते हैं. मैंने एक बार कभी ऐसे ही शुगर चेक कर लिया, कहीं गए थे, उन्होंने एक सैंपल ले लिया, ये भी नहीं पता है कि खाने के 30 मिनट बाद लिया, 2 घंटे बाद लिया, 6 घंटे बाद लिया, और एक रैंडम ग्लूकोज की रिपोर्ट लेके पेशेंट हमारे पास में आ जाते हैं. एक तरफ तो ये टेक्नोलॉजी वाले एरा की बात चल रही है, लेकिन साथ में हम लोग ये भी बहुत बार फेस करते रहते हैं. तो मेरा क्वेश्चन रहेगा डॉक्टर मिथुन आपसे कि व्हाट इज द इम्पोर्टेंस ऑफ दिस रैंडम ग्लूकोज? How much, what significance would you like to give to random glucose report when a patient brings to you?
Thank you, sir. सर रैंडम शुगर जैसे आपने बोला, लोग हमेशा आते हैं, सर मैंने चेक कर लिया, कोई कैंप में चले गए वहां चेक कर लिया, ऐसे ही चेक कर लिया, नया मशीन आया चेक कर लिया। तो रैंडम शुगर का इंटरप्रिटेशन मैं बड़ा सिंपल रखता हूँ। अगर शुगर लो आती है रैंडम शुगर में, तब तो उसका बड़ा महत्व है कि आपका शुगर कम जा रहा है और आपने चेक किया, और क्यों चेक किया। अगर उसने चेक किया कि मुझे पसीना आ रहा था, मुझे तकलीफ हो रही थी, हार्ट रेट ऊपर जा रही थी, तो कम हो गया, चलो आपने चेक किया बिकॉज आपको अच्छा नहीं लग रहा था, तो आपको उस समय उसको ट्रीट करना चाहिए। शुगर कम है, आप उसको ट्रीट करें, ये इसकी बहुत बड़ी वैल्यू है अगर आप उस समय करते हो तो। और यह बड़ा हाई आता है, मैं कहूँ 300 से ऊपर आ गया, 250 से ऊपर आ गया, तो वो दैट सजेस्ट कि आपका शुगर जो भी आप दवाई ले रहे हो वो इतना अच्छा नहीं है, या उसकी संतुलन और बनानी है। आप अपने डायबिटोलॉजिस्ट एंडोक्रिनोलॉजिस्ट के पास जाके, अगर 300 चल रहा है रैंडम में भी, आप कैसे भी पकड़ लो, 1 घंटे बाद, आधे घंटे बाद, 2 घंटे बाद, 3 घंटे के बाद, तो अगर 250 से ऊपर है तो कहीं ना कहीं उसका संतुलन बिना हुआ नहीं है, तो उस संतुलन को लाना है। अब बीच का जो शुगर अरेंजमेंट हो गया, कहीं से लेके 100 से लेके 200 तक, वो ज्यादा हमें इंफॉर्मेशन बहुत ज्यादा नहीं देता है। और इसीलिए कभी कोई पेशेंट आता है तो मैं उससे यही पूछता हूँ कि भाई जब ये किया था तो खाना कितना देर पहले खाया था, ताकि मैं इसका कुछ इंटरप्रिटेशन करके उसको कुछ एक वैल्यू दे सकूं। लेकिन अभी मनोज ने बताया और सर ने भी बताया, टाइम इन रेंज हो रहा है, नई नई चीजें आ रही है। तो डॉक्टर ज्योतिदेव आप हमें बताएं कि व्हाट आर द न्यूअर पैरामीटर्स और द अदर पैरामीटर्स दैट वी मॉनिटर नाउ, जिससे हमारी अंडरस्टैंडिंग और बेहतर हुई है अबाउट मॉनिटरिंग डायबिटीज ओवर द नेक्स्ट फ्यू डेकेड्स। So over to you, Dr. Jyoti.
Yeah. Thanks, Dr. Mithun. So we can.
Jyoti, sorry to, but Jyoti, before you get into that, there are a couple of questions if you can address that. One is pertaining to importance of 3 a.m. sugar, and the other one is acceptable difference in glucose values using a glucometer, CGMS or laboratory. If these two questions you can address before you proceed ahead, Jyoti.
Yeah. Okay. Thanks, Dr. Manoj. So the question is on whether you should be measuring at 3 a.m. So 3 a.m. blood glucose is usually measured when you are suspecting a nocturnal hypoglycemia. So Manoj has come out with a new paper on a nocturnal hypoglycemia. So nocturnal hypoglycemia is the low sugar which can happen when the person is sleeping at night, and that is very important. So if you are having only a glucose meter with you, then the ideal time is place an alarm in your phone. So earlier it was the timepiece and now it is the phone. So you wake up to the alarm, and then soon after that you measure the glucose value. And then you can report to the doctor, because the 3 a.m. glucose can be normal, low, or can be high. So if it is low, then later on the fasting can be high. So you cannot increase the dose of insulin because it is lower at 3 a.m. and then only it has gone up when you wake up. So that is the importance. And the question on what is the other question, Manoj? The difference between CGM, glucometer, and yeah. So when you are using
between all the technologies, how much is the usual?
Yeah, usual. Yeah. So earlier, when we are using only the glucose meters, we actually used to get the capillary glucose value, which is different from the monitored value in the laboratory. But for the last 15 years, the glucometer strips as well as the glucometers are calibrated so that when you are measuring with the glucometer, even though you are measuring the capillary blood, that is whole blood, the results are almost same as the lab value. So if you are using a reliable branded glucose meter, then it is as good as a lab value, or it is better than a lab value. But continuous glucose monitoring, we are developing the algorithms, and with the newer algorithms, it is almost matching with the glucose meter value. And I would say that if you are still skeptical about the difference, usual difference will be somewhere between 10 and 30 milligrams per deciliter. Usually, it is less in the CGM compared to the laboratory. And with respect to the question on monitoring, you can advise monitoring for yourself in the hospital for the patient, or it can be monitoring at home by the patient. So for the patient to monitor at home, it can be the self-monitoring of blood glucose with the glucose meter, and it can generate either a paper diary or it can generate a digital glucose diary. When you are visiting the hospital, you can hand it over, you can send it across. And as Dr. Manoj has said, nowadays we go by the percentage time in range with the help of CGM. That is also assessed by the patient in their own houses, or with the professional CGM. It can be downloaded and the data will be analyzed. So these are all examples of monitoring. But in addition, Home blood pressure monitoring has now evolved as a very, very important component. And there are also point of care devices where the patients can, all of you can use in your own houses if you're affordable, where a couple of lab parameters can also be measured, including the hemoglobin A1C. But I would say that glucose and blood pressure will be the major two parameters to be measured at home by the patient themselves. And this is only meant for preventing the so-called devastating, disgusting, and disappointing, and also expensive complications of diabetes. All these complications are preventable, provided you are following a structured monitoring program for glucose, blood pressure, and for other lab parameters. Thank you, dear friends.
So, Faraz, do we have 2 minutes before we can wind?
Yeah, please.
Right, okay. So, I think there were some other questions that the viewers had asked. One which Dr. Jain can help us with. We've addressed most of them are pretty much on the same lines. Dr. Jain, there's a question on importance of C-peptide serum, C-peptide and fasting insulin levels. What is the relevance, if you can explain that?
Yeah, so there are two tests many times done. One is a fasting insulin and fasting C-peptide. Though both are giving you the same information, that is what is the functional status of beta cells. So how the beta cells are functioning, because when beta cells secrete, it secrete insulin and C-peptide, these two molecules together. If we measure C-peptide, it is a better way to understand the beta cell function. That's why we do a C-peptide test. There is a subset of diabetes known as type 1 diabetes in whom the beta cells are gone, they are destroyed by immune system, and hence they are not producing insulin, and there a C-peptide test help us in diagnosing and differentiating. Otherwise there are many other uses to know is there any insulin resistance kind of thing. So those kind of testing these are, so they are giving us some information about the function of beta cells, and beta cells are the cells which are lying in the pancreas and produce insulin.
Thank you. I think before we hand over to our moderator, Dr. Faraz, well, probably we would like to hear the final take-home message from all the experts, probably starting with Dr. Jyoti and then Sunil and myself, and Faraz can himself give a take-home and wind it up for us. Jyoti?
Yeah, so we have been monitoring glucose for more than 50 years now. And during the COVID times, diabetes, the prevalence has gone up maybe by more than 20%. We don't know. And the relevance of glucose monitoring has now doubled after the recognition of glucose as the fifth vital sign. So my humble recommendation to all my dear friends is to have a glucose meter. Every household in India should have a glucose meter, and it is a life-saving device. Thank you. Over to Manoj.
Dr. Jain, I thought...
या देखिए ऐसा है कि मेरा मैसेज ये है कि डायबिटीज में एसिम्टोमेटिक मतलब कोई तकलीफ नहीं है, इसका कोई मतलब नहीं है. Being asymptomatic is a meaningless thing in diabetes. If you are a diabetic, check yourself, know the glucose numbers, and for that so many technologies are there which we have discussed, and try to keep them in desired range, and that is what is a kind of insurance for you for a good health in future.
Thank you. My message to everyone who's joined in is managing diabetes without monitoring is like walking in the dark. So हर एक इंसान जिनको डायबिटीज है या जिनके फैमिली में डायबिटीज है, अपनी आंखें खोलें through means of monitoring. Only when you are able to do glucose monitoring, whether आप रेगुलर SMBG यूज कर रहे हैं या CGM यूज कर रहे हैं या कोई भी टेक्नोलॉजी यूज कर रहे हैं, monitoring is the key to successful life with diabetes without complications. So invest in monitoring and open your eyes and encourage everybody to monitor and live a life of diabetes without complications. Thank you for joining in. Faraz, over to you.
Thank you, Dr. Manoj, for giving us the right tips. I would say investment. I think all the three of you have made the clear point. Investment, because always is it's not just about the money; it is about the health. I think all of us have learned that during the period of COVID. So do invest in health. And yes, I agree with Dr. Jothydev. Every house should have a glucometer, because we saw in COVID, every house mostly had a pulse oximeter. So now it is time that we keep a glucometer also. And then at the end, let me again reiterate the point that it is very important to control sugars, fasting, postprandial A1C, but we have better tools now. I think the panel has discussed it wonderfully, this uses of CGMS. So जो भी आप यूज करें बिल्कुल करें, मॉनिटर करें. आई थिंक यही मैसेज है हमारा कि आप शुगर को बिल्कुल लाइट ना लें. सिम्टम्स नहीं हैं तो भी आपको मॉनिटरिंग करना बहुत ज़रूरी है. So at the end, let me thank Dr. Jothydev for his very valuable suggestion. Thank you so much, sir.
Thank you, Dr. Perez. Thank you.
थैंक यू डॉक्टर सुनील जैन सर. आपने बहुत ही क्लियर मैसेज, क्रिस्प मैसेज बताया. थैंक यू सो मच.
Thank you.
Let me thank Dr. Mithun Bharti also. He had to leave, I think, but thanks to him, because he was still stuck, but he did join with us. So thank you to him. And then, nevertheless, yes, thank you so much, Dr. Manoj, for moderating it so well. And thank you to all our listeners and people who have joined to make it successful. Thank you all. Have a safe evening.
Thank you.
Have a good.
Faraz, thank you to you and Purvi, the social media team, for putting this together and connecting week after week. So thank you. Hopefully this initiative of RSSDI Diabetes Bytes continues to reach people and improve lives of people living with diabetes. Right? Thank you all once again.
Yeah, thank you.
Thank you.